Position's been renewed, so they've been very kind to me over the years. At the time, I worked for Flagstaff Medical Center as one of its attorneys. I was in private practice, and we were tasked with the assignment of creating Northern Arizona Healthcare, and that was in the mid-90s. And Northern Arizona Healthcare, as you probably know, was formed largely because of Sedona. Verde Valley Medical Center, then called Marcus J. Lawrence, was building a competing facility against Flagstaff Medical Center across the street here in Sedona. The facilities would have faced each other across the street on the property zone. And because of that tension and bad planning on both parts, Northern Arizona Healthcare as a system was born. Northern Arizona Healthcare operates Little Colorado Medical Center, formerly Winslow Medical Center. It operates Flagstaff Medical Center and operates Verde Valley Medical Center, as well as the Sedona Emergency Room, Cancer Treatment Center, and all those facilities that are here in Sedona. Stay tuned, it'll soon be operating the Camp Verde Medical Center. There is outpatient services currently available in Camp Verde, but construction should begin in sometime in June or July on what will happen in Camp Verde. And I'm putting that out there, causing our administration some heartburn, because I hope all of you will replay that message to the administration. And joining me today is Dr. Cindy Beckett. Cindy has and runs a department for the system, which I'm going to write it down so that I don't mess it up. She is the director of evidence-based practice and research. So research activities are overseen by her department. She also serves on what's called the Institutional Review Board that oversees any studies and things that are going on with our system. Chief of Staff, I'm going to wait till he's drinking at this exact moment. There you go. Dr. Sam Buttman. Dr. Sam Buttman is the Chief of Staff for Verde Valley Medical Center. He serves on the governing board. I was responsible for his mentorship coming onto the board. I failed miserably. And my board colleagues give me a great deal of grief that I wasn't successful in getting Dr. Buttman to play well in the sandbox with others. Dr. Buttman, by practice, is a practicing interventional cardiologist, and he is truly a great pioneer here. Sam will downplay this, but our facility was one of the first in Northern Arizona to begin doing stent placement and those type of procedures without open heart surgery backup being immediately available. And Dr. Buttman's been a pioneer in that. He will publicly say, well, others were doing it. The others who were doing it were just a handful around the country. So it made someone who was going through some sort of cardiac distress, it really brought life-saving measures here to the Verde Valley, and Dr. Buttman's been a pioneer of that. And then Lanny Morrison is joining us as well. Lanny's going to be first off today speaking, and Lanny is a professor for Northern Arizona University, and he teaches a course called Healthcare Right or Privilege? Question mark. Great course, and he told me earlier today that the 18-year-olds who go through the course end up knowing more than 99% of the American population in a very short time, based upon having gone through his course. And Morgan's here joining us as well. Morgan's with Planned Parenthood. She's going to speak briefly on the Affordable Care Act's impact on reproductive rights, and she'll be doing that in a few moments. I'm going to be speaking last. I'm just going to be telling you about the Affordable Care Act's anticipated impact on the Northern Arizona healthcare system, what it means in terms of dollars and cents locally here, and we are welcoming everyone's questions. I've already got a number of questions, and I will go ahead and group the questions. Please complete the questions while folks are speaking. They anticipate that, and that way we'll get most of the questions answered in such a fashion that we can do them in a group approach. And we did receive one question. Do you guys, does one of you have it? Because I have to read this question as a starting point. One question that came to us: will the Affordable Care Act cover Tea Party mental treatments? Someone has a great sense of humor already in the audience. The short answer is, if they sign up, yes. So that was one down. So we're welcoming all the more questions as folks can bring them forward. Please do. Juliet's agreed to kind of go up and down. Just raise your hand. She'll come up and pick up your question as it goes.
Two other people, too.
And Barbara. Oh, hey, Barbara, how are you? Good to see you. And others will be working through the room, so just raise your hand. It'll be available. So, Lanny, if you're set, we'll go ahead and take it and turn it over to you. Thank you.
I think I'm all set. Is this on? Can you hear me?
Yeah.
A little bit of background on myself. I do teach at NAU. I also do health policy work for a number of states, most recently with the state of Rhode Island, where I've been helping them build their health insurance exchange. Unlike Arizona, they have their own state exchange. I've also been working with them on their Medicaid expansion program, similar to what is happening here in Arizona. You spent years doing policy studies in the healthcare arena for the federal government, state governments, and some local governments. Worked for a giant healthcare corporation that owned over 300 facilities worldwide, doing strategic planning, working with insurers, and doing government relations. So my background is very broad. What I'm going to present to you really is an overview of the Affordable Care Act, and this is how I start my students out, so they understand what it's about, because everybody's heard a lot about it, and most people do not know the details of it. So I'm not going to enmesh you in the 2,800 pages of the law or almost the 10,000 pages of regulations that follow it. But I'm going to condense it down so at least have some common talking points. So the first thing I want to talk about is that it's really the Patient Protection and Affordable Care Act. That's what it's called. And it's actually two different acts. The first one was passed and signed by the President on March 23rd of 2010. My wife said, move over so they can see the screen. It's all behind Dr. Buckman. Okay, I'll come back up here. So it passed the Senate by 60 to 39 vote, passed the House by a thin margin of 219 to 212. You've all heard about that. This was when the Democrats were in the majority in both the Senate and the House. Then there was the Healthcare Education and Reconciliation Act of 2010. That was the other part of the law that was passed. And it also passed by almost a smaller margin in the Senate, and passed by a little bigger margin in the House, and was signed into law by the President March 30th of 2010. So the two laws combined are called the Affordable Care Act. I try not to use Obamacare because I find that people use that simply to be derogatory towards the President. So I'm going to try to stay away from that here. It is a very complex law, and the law itself was about 2,800 pages. When I was doing work for the state of Rhode Island, I actually reviewed all the drafts of that bill because I was providing consultation to the state about things that they should be looking at, be aware of, and hopefully try to get changed. There are 90 major provisions in the Affordable Care Act. So it's not surprising that people have difficulty understanding some of this. I have difficulty understanding some of this. And when you add in the regulations, it becomes more difficult. Most of the Affordable Care Act is already in effect. And I'm going to go through some of the provisions. 26 provisions went into effect 2010, 18 in 2011, 10 in 2012, another 11 in 2013. And 2014 was where most of it was, the rest of it was supposed to kick in. There's drips and drabs that will continue on to 2018. The 2018 one is simply establishing a tax on high deductible health plans, very expensive health plans. So this may be hard to see, and I tried to take the major provisions of the Affordable Care Act. First one is the individual mandate, which you're all now hearing about because it becomes effective January 1 of 2014. What it basically says, if you are uninsured, you have to buy insurance, and if you don't, you're going to be penalized. And the Supreme Court voted on this, as they tend to do. They rendered a decision and said, yes, that is indeed legal to do, because the Supreme Court said this is a tax. And the Congress of the United States has the ability to levy taxes. Second thing is guaranteed coverage for adults with pre-existing condition. That's another one that's supposed to go into effect. Everyone has I believe almost everyone in this room probably has pre-existing conditions of some kind. Okay. I'll give you an example. When we first moved to Arizona 7 years ago, I was not yet on Medicare and was looking for an individual health insurance policy. And given as much as I know about healthcare, I thought, geez, I'm coming from Arizona. How bad could it be in Arizona? I was coming from Maryland. How bad could it be in Arizona? And I found out, since I'm a diabetic, although it's controlled by oral medication, that I could only get a policy that was going to cost $1,800 a month with a $5,000 deductible, and they were not going to cover anything that was diabetes related. Okay. That didn't sound much like health insurance to me. So we were able to actually continue on the coverage that we had in Maryland, and sometimes some services were not covered. We paid for those out of pocket. Now, beginning in 2014, insurers are not going to be able to keep people off insurance because of a pre-existing condition. They're not going to be able to use that pre-existing condition to establish different rates of insurance. The only things they're going to be able to take into account are a person's age, where the person lives, and whether the person's a smoker. No longer can they use gender, because they've always used gender to charge women more for health care. That's not going to be possible anymore. So no longer charging higher premiums because of health status or gender. Medicaid expansion. What it's saying is that part of the law mandated that the states expand Medicaid for people up to 133% of the federal poverty level. And Jim's going to talk about that, of how it happened in Arizona, where people were kicked off the rolls if they were childless adults, and how they're going to be coming back on, the impact that that has. Most of the states are doing some kind of Medicaid expansion. When I say most, it's 26 of the states. If you go through the southern tier and then go up straight through the Midwest, you will see states that are not doing Medicaid expansion. The Supreme Court said that you could not mandate the Medicaid expansion. It has to be voluntary on the part of the state. So some of them are doing it. But it's being financed 100% by the federal government for the first 3 years. And it was very important because this was a group that, because of the way this law is written, they're going to be people who make less than 100% of the federal poverty level that can't be on Medicaid in a state because they would have been covered with that mandatory Medicaid expansion. So take Alabama, for example. If you live in Alabama and you're a poor adult, you have to be so poor to be on Medicaid that you cannot make more than 10% of the federal poverty level. Okay. So you're talking, $1,100, $1,200 a year. That's the maximum you can make. Texas is the same, 10%. Health insurance exchange, and this is the one you're all hearing about. Certainly the federal exchange that's had more than its share of problems. You can't log on, you can't get an account, you can't, a whole lot of things. And there's a lot of reasons for why this happened. But the health insurance exchange was supposed to go into effect. Then premium tax credits to help people buy coverage. And this is how poor people were going to be subsidized, were be providing by tax credits. Interestingly, this was first proposed by the Republicans as a counter to the Clinton health plan. It was proposed by Senator John Chafee of Rhode Island and 25 other Republican senators. They said, this is what you should be doing. All of a sudden, this is now a Democratic idea that the Republicans don't like. Then, premium tax credits for small business, less than 25 full-time workers, that's been in effect since 2011. Employer mandate for business with more than 50 full-time workers, that has been delayed to 2015. Young adults can stay on their parents' plans. So one of the first things I say to my class, raise your hand if you have health insurance. And these are 18-year-olds, first semester freshmen. All of them raised their hands. I said, how many are on your parents' policies? And they all raised their hands. I said, Affordable Care Act. That's how you were covered. None of them knew it before I asked the question.
Wow.
Coverage for pre-existing conditions for children. You cannot keep children off of an insurance policy because of a pre-existing condition. There are almost 5 million children that would be affected if this was not in place. too much. Closing of the Medicare prescription drug donut hole. I guess besides me, there may be a couple other people on Medicare here. So you know that what the donut hole is for Part D Medicare prescription coverage. You know, the government pays an amount up to this donut hole. When you're in the donut hole, you have to pay out of your pocket, and then if you spend a lot more, then you get out of the donut hole on the other side. Well, the Affordable Care Act closed some of the gap in the donut hole. The ban on rescission. This is canceling coverage. What was happening too often is that you would get sick, and all of a sudden you'd find out that your insurance canceled your coverage. Happened with too many people. That's no longer allowable. Ban on lifetime coverage limits. Almost every insurance policy in place, commercial insurance policy, had a limit on lifetime coverage and also annual coverage. This is the maximum that we be paid. Those are being banned. There was an early retirement reinsurance program. There was an initial temporary health risk pool that was set up for those people who did have a pre-existing condition. And something called medical loss ratio. Insurers have to spend at least 80% of the premium dollars they get now, and this is in effect, on healthcare benefits or on activities that lead to improved quality care. So, for example, my wife got a letter from Blue Cross and Blue Shield of Arizona a year ago that said, here's a check because we didn't spend enough money on paying for health care. And that there were over $1 billion paid out nationwide because of that. Then we have coverage of preventive services, and this affects Medicare. Medicare must provide preventive services. Every insurer must provide preventive services without any kind of cost sharing. And then a birth control coverage requirement, and Morgan will be glad to tell you about the family planning coverage for that. The individual mandate will allow for individuals to be exempt in some kind of way. Undocumented immigrants cannot participate in this. If you're religiously opposed to acceptance of benefits, you would not be covered by this. You don't have to apply. If you're a member of an Indian tribe, you do not have to participate in this. And there's all kinds of coverage that's available. And then at the bottom is a penalty. In the first year, it's not very much. It's $95 for each adult and $47.50 for each child, or 1% of income, whichever is greater. Then it goes up in the other years. Who would be adversely affected if the ACA were repealed? The House of Representatives voted 42 times now to repeal it. Okay. Some 3 million individuals under age 26 on their parents' health insurance policies would lose their coverage if it were repealed. More than 5 million children with pre-existing conditions. Some 135,000 adults with pre-existing conditions funded through the Affordable Care Act health risk pools. Individuals on Medicare Part D whose drug coverage was expanded. That would be taken away. The hole would become bigger. Individuals on Medicare and private insurance who have coverage for preventive services without cost sharing. Individuals who receive rebates, like my wife, because their insurer did not spend enough on actually paying health care benefits. And millions of individuals who would be covered by the Medicaid expansion. That would all be lost. Right. The employer mandate is delayed until 2015. It is simply for any employer with more than 50 full-time employees, and there's certain other criteria. They have to provide benefits or they will be fined. Okay. There's some myths about the Affordable Care Act. You hear them every single day. Some myths are true, some aren't true. Here's some of them that I just picked out. Millions of Americans can't find full-time work and it always says Obamacare. Obamacare is a federal takeover of healthcare. And I tell my students, if you answer that way on the midterm, if you answered that way on the final, you're not going to pass this course. It's that simple. The law is a job killer. You hear that one all the time. There is absolutely no credible study out there that says how many jobs would be lost. In fact, jobs in the healthcare industry would be created. Premiums are going up because of the law. Premiums are going down because of the law. Well, some are going up, some are going down. Okay. All of the uninsured will pay less on the exchanges than they would now in the individual market, even without federal subsidies. People who have individual policies are paying through the nose right now. There's not somebody who has an individual policy who will be charged more unless they have what's called a high deductible plan. You know, they're paying $5,000, $6,000, $7,000 of deductible for their recovery. You won't be able to choose your doctor. That may or may not be true, depending on which plan you sign up for. Okay, but you know, if you're on Medicare, you're not affected by this. If you're on private insurance through an employer, you're not affected by this. If you like your plan, you can keep your plan. I believe the president said that. I believe the president is having to retreat from that. If you like your doctor, you can keep your doctor. Yes and no with some of this. Congress is exempt from the law. Well, members of Congress and their staff have to go through the health insurance exchange to get their insurance. Period. No ifs, no ands, no buts. They're all affected by it. Okay. Obamacare affects your Medicare coverage.
There's more to that, sir.
Pardon me?
There's more to that period. Is that the government will supplement their increase. In other words, they will receive a supplement.
Okay.
Not necessary to interrupt.
But they still have to go through health insurance exchange.
Can I ask if, write that down as a question so that can be discussed in the question and answer period? Thank you.
Okay, since my time's about up, I wanted to leave you with a quote from Rick Newman, who's one of the internet healthcare bloggers. If the scaremongering over Obamacare ever stops, we're doing the changes in healthcare benefits may no longer require hypertension medication. Thank you.
There are always people in a group that can't hear well, so.
What did you say?
That was going to be my line. All right. My name's Sam Bob, and I really don't understand the Affordable Care Act. So I'm only here because Jim asked me to be here. I'm a physician. I checked. I think I'm still going to get paid next year. I work for the hospital. I'm not Medicare eligible yet, but I'm getting closer. So many of you will have to explain to me my benefits when that time comes 3 years from now. But I did put a few slides together just to give you my perspective as basically a person, not so much as a physician, perhaps as someone who came from Canada. When I was finishing medical school, national health care went into place, and I thought it was really a good thing. And it was a good thing from an ethical perspective. Of course, back then I wasn't really paying any significant taxes, so it didn't make a big difference to me. There was a lot of yelling and screaming, but it still didn't make a big difference to me. And when I was moonlighting, it was a very simple billing system back then. It's only simpler now. Back then, if you wanted to work for Medicare, which is what it's called in Canada, you were given a little machine that you scraped cards over paper, like you would if you were in a store in the old days, a Visa thing. That's all you got. I sent all my bills in that way. There was no middlemen. There was no insurers. There were no people skimming money off the top. Anyway, this is my brother, 13 years ago. That's a young lady we won't get into. She's a skier. And that's my brother drinking a glass of whatever in Italy the day after he broke his arm. I'll let you guess what it cost me, because I'm the only one who had a Visa card, to pay for him getting a cast at a mountain resort by orthopedic surgeons who also had him recasted the next day with x-rays before and after because it had to be readjusted.
Nothing.
No, come on. $75. $75.
That's nothing.
That is nothing. I was in the emergency room here. I really don't use healthcare very much until 2 weeks ago. I had a kidney stone.
Oh.
I diagnosed it myself because I'm a doctor. We take care of my, I went to the emergency room. I just passed through, said I need to, let me give you some urine so I can check. And I had a CT scan. I apparently got billed for this. I won't say how much because we bill a lot, but I'm still paying. And it was in the thousands for something that was pretty straightforward. So it's a different world.
Don't pay it.
And I just show that slide because it's a reminder for why we have the Affordable Care Act. So you heard already some of the things I'm going to say. I'm going to flip through if it's fast, but just a reminder for why we're doing this. Whoops, that's not the right button. This is hot off the press from last week, frankly, by the Kaiser Family Foundation, a non-political group that does very good research, very committed to healthcare improvement. 17 million people could be eligible for premium tax credits under the Affordable Care Act. Over half of the 29 million Americans who are either uninsured or purchase health care on their own. So that a lot of people, when we hear the complaints about the potential additional costs, we always do not hear the skimmed over reality of many of those people are going to be getting credits back. How many? We'll hear about this for the next 3 years, I'm sure. So why do we need a reminder for why we need health reform? You know, this is 2009 when the health care bill was approved, the debate for the years before, and we never are reminded now for why we wanted this, because he was voted into power because the country wanted this. Too many people lack health care coverage and care. I'm focused on treatment, not prevention. Okay, I do a little bit of preventing, but that my background is to do a lot of treating, of course. The fact that there's different health in different states, how well people care for each other in different states varies remarkably. We're inefficient, no question about that. How we deliver the care, how you see your doctors, how you make your appointments, how the doctors get paid, the whole mishmash of it all. And of course, we all know that there's no question, Republican or Democrat, a system would have been put into place to change what we were currently doing in the past to what we're currently doing now, which is trying to make it not so expensive. And then the last one is we suck compared to other countries when it comes to healthcare. I know it, I say it pretty much every day that you're all getting the best healthcare here, okay? But relative to other countries in similar situations, you're not. That's the remarkable part. Even when we compare ourselves to Canada, where there's waiting lists and all that other, when you look at mortality rates and how well people get preventative care, forget the waiting lists, people are doing better. Here's just a picture of that. So we're also moving towards the triple aim. This is important in Northern Arizona healthcare, and it's also important in what we want as a country. What are the triple things we want, the three things? We want to improve your experience. We want you to always leave our offices and our hospital using the word excellent. Very good gives me nothing. Any of you patients of mine, I want you excellent, because pretty much half this audience is my patients, are my patients. I know you're out there. I've seen you too. So we want to improve the health of the population. What does that mean? It does mean giving. It means that some people are going to be giving up. Some people will be paying more. I'm pretty sure I'll be paying more in taxes because my income is good. I'm still making income. I understand that. I accept that. That's the price you pay. And then we want to reduce the cost, obviously. So the triple aim is we want to make everything better that's not good. Insurance reform. Let's see. More people covered. More people have benefits. You know, the complaints about, I guess we're hearing that Obama misspoke about you won't have to change your plan. Well, you have to if your plan sucked. If you bought a plan that you thought was good, it turns out we're trying to tell you, or the government's trying to tell you, that doesn't sound good that the government's telling you, that your plan really wasn't that good. It didn't have the things that you should have. Now, granted, we don't like government telling us that, or maybe we do like government telling us that. Whatever the political view is, it doesn't really matter. The truth is, there's a reality check here, and this is a reality check that's been done by experts. Lower cost, sure. Let's see, yeah, that's all the same stuff you heard now, right? So look at that one quickly, because there, I'll make it easy for you on the next slide. The things that are in bold are the only things you have to remember. Most insurers now, with Obamacare, there I said it, okay, cannot deny coverage to pre-existing conditions, but the bold, you can't rescind coverage. That's the one that bugs the hell out of me. Stopping insurance because you got sick.
Yeah.
I know this happened to me once when I had 3 strikes against me on my car insurance. I didn't know car insurances could do that. You can't get insurance for your car, which means you can't drive. I found Guido Insurance Company from Chicago. For 3 years I had to use that. And of course, charging women more than men, that just is remarkable in itself. And then of course, you want to cover the essential health benefits. And that goes back to this Obama misspeak about you can keep your policies. And we want to spend more on services, less on profits. That's the bottom right there. Of course, nobody likes, unless you own unless you own stock in an insurance company, you don't want them making too much money off your health. Stronger work, oh, never mind that. Let's just, the big finish here is, oh, never mind, there's in Obamacare, in the Affordable Care Act, what's that? Stop talking.
No, keep going, you gotta go.
I only have one more slide, I think. All right.
Talk, you know.
She was going like this to me, which means you're talking too much. Beware of her. So there are benefits that really accrue to you. You're all pretty much Medicare receivers. By and large, most of this talk is really not about you at all, except it is on things that you really don't hear about. Number one, there's money set aside to make health care in the community better, which is a good thing for the community. It's good for you, your families, people who visit the area, etc. And I think even more importantly is my last slide. And this is important to me, to you, and to everyone here, because our hospital, your hospital, now more than ever, the Flagstaff Hospital, we actually have to spend time and money finding out from you what you need. That's part of the deal. So hospitals always want to do that in the community, of course. But actually it's mandated that there's what's it called, community health needs assessment. That has to be done every, is it 3 years? So there's actually open forums like this, done all over the place, different levels, business, consumers, patients, workforce, to find out what we're doing right, what we're doing wrong, what we need to be doing, where we should be focusing. And let me tell you, I'm on the board now, Jim knows this, we are changing what we do. Our commitment to building better and more active centers, even if they're money losing, is part of the commitment. And then I made this bold because this, issues to watch. Forget all the issues. It's consumers' confusion. And of course, the website just added insult to injury. The good part about the website is it's not designed for Medicare-aged patients. It's ideally designed for young people because we need young people who need insurance to balance the cost of all those other people, including me, who might have medical problems. So it really was designed for the right people. They just didn't have the right people designing it. And then this is something you can forget. There's lots of resources. It's called Google. Just write healthcare reform, Affordable Care Act, Obamacare, any of those words, and you'll find 3 billion hits probably. Anyway, thank you.
Partly because of the Affordable Care Act, but it's something that I think is very important. 3 years ago, I was asked to look at a healthcare model to address some of the issues that were being mandated by President Obama. With the start of affordable health care, one of the things that he impressed on CMS with all of the Medicare providers is that hospitals had to first identify policies and procedures that supported you, the patient, and that you as the patient needed to have the right to identify a person that was going to be there for you, a patient representative, a patient advocate. And as part of this rule, first we had to create the policies and procedures, educate patients and families that you had the right to have a patient representative, and then we needed to make sure that everything that was put in place at the hospital did not discriminate against anyone or any person because of who you identified as that patient or representative. And lastly, we need to protect your visitors or your patient representative. So what I want to share with you in the next few minutes is how Northern Arizona Healthcare is moving in that direction to really help meet those needs, which I think if you're hospitalized, which I hope none of you have to be hospitalized at any time, but if you are, we want to make sure that we are meeting your needs in terms of the Affordable Care Act. Patient Family Centered Care is the model that we have chosen at Northern Arizona Healthcare to help us meet those needs. And what it does, it allows us to make sure we're meeting the needs that you see. I've taught nursing for, 30 years plus, and I always used to tell my students, you want to treat others as you would have them, you would want to be treated yourself. Well, it goes beyond that. You want to treat the patient and the family the way they want to be treated and meet them where their needs are. And I think it's very important as healthcare providers that we make sure when you come into our hospital or you come into the community clinic or any aspect of what we're doing, that we are helping you to be an advocate for yourself, to make sure that you are, as you are selecting providers through your healthcare options, as you are partnering within the community, that we are doing that with you. Part of Patient Family Centered Care involves 4 concepts. The first one is respect and dignity. And I think each one of you would say, absolutely, that should be a no-brainer. Everyone should be treated with respect and dignity. The second aspect is information sharing, making sure that we keep you and your family members informed of critical issues. In healthcare, there was a huge red flag when we started talking about this, because they went, well, what about HIPAA, which is protection of your medical information? Well, you as the patient would tell me as the provider who you wanted information shared with. And so you don't just share with everybody, because we don't know if your next door neighbor is in there or your family member. So we would ask before information was shared in front of you. Something that I think is very important with Patient Family Centered Care is truly participating with you, partnering with you from the moment you come into healthcare till you're discharged, and we do follow-up care. So having that opportunity to truly partner with your healthcare provider is going to be very important. Collaboration is building our entire structure, our policies, our procedures, our hospitals, our facilities, with you in mind, and with feedback from our providers. So this is something that we are integrating across Northern Arizona Healthcare to begin to meet some of those needs. Again, I've been a nurse for 30 plus years. When I graduated in the 80s, we used to do things to patients. You come into the hospital, the doctor would write the orders, and we would tell you what you needed, whether you really thought that or not. And then we decided we were patient focused. We did it for you. Well, now we're doing it with you. So as you come into care, we want to make sure that not only do you have choices and access to care through the Affordable Care Act, but that also as you work with doctors, with providers, within the hospital and without, that we're doing it together with you. One of the focuses that I've had trouble getting people to understand is who is family. So I want to spend a little bit of time talking about this with you. And through the federal government, it can be someone that's biologically related to you, someone that's married to you, someone that you identify as your partner. So it can be blood relatives, it can be best friends, it can be a partner, a live-in partner. It can be your animal. We have pet visitation at FMC, and we take it very serious because I've had families that, I had a gentleman a few weeks ago who was in a very serious trauma coming through our community. Didn't live in the Flagstaff area or even in Northern Arizona, but was in a really bad trauma. He ended up in the ICU for 3 weeks, and he was just really depressed. And when we asked him what he needed, how could we help him? He said, I want to see my dog. He said, my dog's in the RV, but the dog can't come in. And we said, of course the dog can come in, as long as you can show us that the dog has had shots and is well behaved. So we worked and got the shot records from Vermont, faxed to us, and we made arrangements for Charlemagne, this beautiful dog, to come in and visit him on a regular basis for the rest of his 3-week stay. That was his family, and it made a huge difference for that person. So we have to think out of the box when we're talking about family. What we're doing is trying to see things through your eyes, and part of that Affordable Care Act is really giving you choices So as you start working to pick your doctors, to pick your health care, look for people that want to partner with you, that want to advocate for you. We're doing a huge job around that culture change with every person in our organization, from our housekeepers, our facilities people, our nursing staff, our physician staff, and we're working with patients and families as advisors within our community. At the hospitals, we're focusing on that patient experience, as Dr. Butman said. We really want to make sure that we're not just doing a good job, that we're truly doing an excellent job and doing it from your perspective. Not that we are telling you how your health care is going to be given. We have advisory councils, committees, again, changing our whole policies and procedures. The Affordable Care Act identified that need and that requirement for us to be patient-centered. But again, we started moving in this direction right before President Obama mandated that we do this. So we were very excited that we were already moving in the right direction before this happened. And I'm excited because I think I'm a mother of three adult sons, all who have college degrees, none of which are insured, because they either work in jobs that don't offer insurance, or they're underinsured because they're working in places that don't have options. And I have one that had a brain tumor 8 years ago. So for me, affordable health care and having that pre-existing clause is very exciting to be able to have my children be able to have health care. As we move forward, that patient bill of rights, and you'll hear lots and lots about the patient's rights to receive care, the rights to select a health care provider, to have preventative care. To me, these are very exciting options for all of us. Ultimately, our communities are going to be healthier. You're going to have options that you hadn't thought about. And I think the increase in women's prevention is so exciting, especially around domestic violence, breastfeeding support. I'm a labor and delivery nurse forever and ever, so getting that start for that baby from the very beginning and helping that woman to be successful in parenting and child rearing is going to help us create generations of healthier children. So I think the Affordable Care Act is giving us more options and is giving us a chance to build that healthier community. And we as a community can decide what is important for us to have included and what's not. Sorry, I'm getting dry here. Real quick. As you look at the patient, the patient bill of rights, again, it covers pre-existing conditions, your choice of doctors, keeping young adults covered, end of life time limits, which I think for some people, if you've got diabetes, you've got cancer, you're going to run out of those limits very quickly. So I'm very excited about that. Arbitrary withdrawal of insurance coverage, to me, that was a horrible rule. The premium issues, how to get more getting more for your dollars, restrictions on limits, all of these you're going to hear over and over again. It's really a benefit to us. And I think for those people that are just screaming and yelling and saying negative things about it, they haven't taken the chance to really try to understand what this can provide them and their families. The benefit is truly creating a new opportunity for us to integrate patient and family wishes and needs, building a community model that's truly patient and family centered, and that's going to give us an improved health care, not just within your household, but within all of Northern Arizona. So I think for us, from Northern Arizona Healthcare, this is a very exciting opportunity for us to really make a difference. And we're wanting to have you guys involved with us. If you're interested in being on a family advisory council or getting involved within Northern Arizona Healthcare, please let us know, because it's individuals like yourselves that are going to help us know that we're going in the right directions through affordable health care. So our facts, just kind of to summarize, is patient and family-centered care. We've really gained momentum across the country, and I think we're leading some of the efforts within the state. We're one of the few hospital systems in all of Arizona that has embraced patient family-centered care. We are integrating it into all aspects of our care and our processes, and I think you're going to be able to see that within our community and our efforts. As we look at creating more community activities, more home care processes, and more real population health processes, you're going to see that integration and advocacy for each one of you. More and more of our providers are buying into this. And it was interesting when we first started. This is real transparency. Sitting down with patients and families when you come into the hospital. If we make a mistake, if we make an error, sitting down with you and saying, we made a mistake. Owning it, being responsible for it. Sitting down together and making decisions about what you need before you go home. For some providers, this has been a difficult process, but more and more are buying in and getting involved. Focusing on outcomes. My background is evidence-based practice. I work with a lot of research and I work with the providers to make sure we are researching and finding the best protocols and the best processes so that you have a shorter length of stay, a better outcome, and not just for your hospital stay. We don't want you to have to come back to the hospital and have to be readmitted. So looking at things that are going to help you before, during, and after that hospital stay. So I think for us, it's been thinking differently, creating huge population health focuses, looking at how we can create better processes. So in conclusion, I just want to help you to understand that we are really there for you. For us, Affordable Health Care, this act has made us think differently. It's made us begin to really evaluate how we deliver care, how we practice, how we provide care for you. And I mean, it has been a challenge because we're not sure how it's going to impact the financial aspects of any organization. But I think for the right reasons, we are seeing huge improvements in quality, improvements in outcomes, involvement in patients and families in their own care, increased satisfaction in the patients and families that come to see us. And it's all because of this focus of this is where we need to go. So for me, I think it was a great thing to happen. And I want to share, just to finish up, I don't know if any of you have heard the story of the tiger and the pig. Anybody heard that? A few of you, I see a few hands. In Thailand, several years ago, this beautiful, beautiful tiger got pregnant. And they were very excited because they were wanting her to have a baby in the zoo. Well, she miscarried. And evidently this tiger was a very rare strain. She was very precious to this zoo. She became so depressed, she got postpartum depression because of the loss of her pregnancy. She refused to eat, and they thought she was going to die. Well, a different zookeeper from across the zoo had a great idea. He said, well, the mama pig had a huge litter of piglets. What if we gave the tiger some babies to raise? Maybe she wouldn't be so depressed. Well, you can think about this. Tigers, pigs, might not be a good idea. They found some tiger fuzzy cloth and they rubbed it all over the mama tiger. They let her lay in it, they let it get her smell. And they cut out and made little tiger suits for 6 piglets. And you knew one of two things was going to happen, right? Well, I'm happy to report, as you see in this picture, this beautiful baby pig is laying with its mama. So if you were to say, this is your patient, Mama Tiger. She comes into your institution or into your office and says, I want my family involved in my care. And then in walks 6 little piglets. You might say, well, I'm not sure if that's going to work. But it's not us to decide who your family is. It's not us to decide who you should have involved in your care. So as you go forward, know that the Affordable Care Act is going to be there to support you. So no matter what the family makeup is, no matter who they define as their family, we're going to support that, we're going to honor that, and we're going to make sure that family has all the rights to visit and to be a part of your care. So for me, I always think about the tiger and the pig, because if this was my family, I would want to make sure they could be involved. So for me, I think it's great. So thanks.